I come at it from a very personal place. I see kids in my practice who are on numerous psychotropic drugs, and they're not doing well. As a society, do we embrace the idea that it's acceptable to drug children who can't advocate for themselves? That's why we as parents and caregivers are the ones who are supposed to make informed decisions on behalf of children because they can't do it on their own. Do I think as a society we're doing a good job in that arena? Absolutely not.
It began in 1968 with the founding of the International Schizophrenia Foundation, founded by Dr. Abram Hoffer and based on the work of Linus Pauling, who coined the word orthomolecular in 1968 in a famous article in Science, which just refers to balancing the biochemistry, using the right molecules, and according to individual biochemistry.
My son started having difficulties at school. There were social issues, getting along with other kids, and we did an assessment, and he was assessed with ADHD. I spoke to my medical doctor when I started the process because, you know, I wasn't 100% sure of what I should do. And he suggested to me, I was very lucky that I had a doctor that told me that, you know, go to drugs at the end, not in the beginning.
You want to be able to give children things that are ethical and that are safe. So orthomolecular medicine fits that idea. I mean, you're giving something that is found in our food, so it's very natural, i.e. it's safe, and then it's ethical. It's not going to alter brain chemistry. It's going to only support their natural chemistry and physiology.
Well, it began about 6 to 8 weeks into grade 1. 6 weeks later, we started getting calls from the school of how she wasn't listening, she was impulsive, she had self-control, she just didn't have any self-control, couldn't keep her hands to herself, and so we began to meet with school, and it was it was really tough. We took the list the school gave us, and we took it to the doctor, and we showed him the list. He read it, he looked at us and says, well, she must be ADHD. And
it was kind of surprising that without any kind of other analysis or testing, he just gave us this, you know, this prescription.
For some reason, when it comes to children, the standard approach is to begin with drugs, especially in problems like ADHD. When you have you know, 6-year-old kids with the diagnosis and they're on up to 2 or 3 drugs or antipsychotics and behavioral modification drugs, it's remarkable that we're leaping right to that approach rather than looking at underlying causes.
Since we started treatment 3 years ago, we've seen continuous steady improvement. His marks improved. You know, the end of the year was much better than the beginning of the year, and the second year was much better than the first year, and now is the 3rd year since we've started, and things have improved overall. So we're quite pleased.
I did find a nutritionist who suggested that we do a food allergy test, and we were very surprised when it came back to find out that she wasn't just allergic to dairy, she was highly allergic to gluten. So, and among a few other things. It took at least 6 to 8 months, but by the time she finished grade 1 and she went into grade 2, that we began to see, you know, she was doing a lot better.
It does represent solutions that are likely to produce a lot of good, less side effects, promote health, and really support and help the biochemistry instead of alter it.
Don't just think about the now, think about 5, 10 years down the road, what you want your kid to look like. Where do you see your kid being, and plan ahead.
Keep an open mind, not think of medication as a first line of defense, but more of a last line of defense.
I wanted to do what was right as a parent for my child.
Our goal is in the next 5 years to have hundreds of physicians and other healthcare practitioners who are familiar with and trained in the orthomolecular approach, so that they will be there when parents go looking.
And if we support an organization like this, we can get the message out that there is an alternative.
I love the name Mindful as sort of a campaign, because think about it. We should be mindful of what our kids are doing. We should be mindful of what's being prescribed to them. We should be mindful of what we put into their bodies. So what it is really, it's raising a level of consciousness about how we should be treating our kids and how we want them to be treated over their lifetime.